Dr. Don here from Movement Medicine in Montrose, Colorado. Today we're going to be talking about MRIs because over the last several years there's been so many MRIs that I see of patients that have had back pain for a relatively short period of time. And there's a lot of reasons for that, but none of them are good reasons or scientific reasons. Let's go over some of that right now. Because over half, the Journal of the American Medical Association in 2013 said that over half the requests were either inappropriate or of uncertain value. Family physicians were the most common doctors to recommend MRIs. Why is that? Well, you've had a relationship with a patient for who knows how many years. They come in, they're dying of back pain. You just want to make them happy. And so you say, they want an MRI. So you say, oh, I know it's not the right thing to do, but they're going to be ticked off if I don't order them an MRI. So the doctor acquiesces and orders an MRI. But there's serious problems with that because it leads to poor outcomes, basically. And I'm going to get to that in a minute. But there was a study also that said that they had 98 asymptomatic people, meaning they had no back pain at any level. And here's what they found, that 52% of the subjects had a bulge at least one level. So 52%, over half of them, had a disc bulge and had no pain at all. 27% had a protrusion. That means a protrusion is where that disc is kind of torn and then that jelly-like substance can leak out of that disc against some of the nerves or against the spinal cord. That's a protrusion. And 1% had an extrusion. That means that the disc has gone through that annular fibers and then is now floating around that spinal cord. 38% had an abnormality of more than one intervertebral disc. So an anomaly is like something isn't right. You know, it's not shaped right, it's too thick, it's too thin, it's inflamed. 38% had that problem. The prevalence of bulges, but not of protrusions, increased with age. So as you get older, you get more bulges. Things wear and tear. It's just like my face has a lot more wrinkles than it did when I was 25. That's because over time, tissues get stretched. They wear out. It's like wrinkles on your skin when you have a disc that's bulging. 14% had facet arthropathy, meaning degenerative disease in the joints in the back of the spine. 14%. So when you get an MRI and you say, okay, now I know it's causing my back pain. I have a disc bulge and it's causing all this pain. Not necessarily true, because in all these patients that had no back pain at all, they had all the disc bulges. They had so many and so many different kinds, but they didn't have pain. So get that. They had disc bulges. They did not have pain. That's what most people have. Okay, and then they did another study where they had 37% of the non-specific low back pain and 79% of radiculopathy cases received an early MRI. That means before 1 month. Years ago when I was in school, it was 6 weeks. Now it's 1 month. Anyway. The early MRI group had similar outcomes regardless of radiculopathy status. Much lower rates of going off disability, and on average $12,948 to $13,816 higher medical costs than the non-MRI group. So just getting an MRI adds $13,000 to $14,000 to the average low back case. Why is that? Because the MRI is only somewhere around $1,200, I think. But what it does is give the patient a scare and say, wow, I have a disc bulge. I can't do this and I can't do that. and I better not do this, and I better not do that, and I better not go back to work, and I better not strain my low back, because if I do, oh man, this disc bulge is going to blow out and I'm going to be crippled for the rest of my life. Not true at all. So knowing that they had the disc bulge actually didn't work in their favor, because they didn't return to work as well as the people who did not have the MRI. So medical costs were on average $7,643 to $8,584 higher in the MRI, early MRI group. So if you get an MRI within the first 30 to 50 days of an injury, it's going to cost you on average $7,500 to $9,000 extra for that incidence of low back pain. Not really worth it, because then you go for all the tests, you have extra shots, you have injections, you have more physical therapy, because now we can look at it and see that that is a problem. So I know it's hard to understand, but sometimes knowing more is not necessarily a good thing. Let's look at another study. It says, although MRI is a sensitive diagnostic tool, it is highly nonspecific and reveals abnormalities that are often poorly correlated with symptoms, with disc herniation and/or spinal stenosis found in 20 to 57% of asymptomatic subjects. So 20 to 57% of people have disc herniations and/or spinal stenosis. Even in acute radiculopathy, early MRI does not provide information that improves treatment decisions or outcomes. Despite these concerns, the rate of spinal MRIs in the medical beneficiaries increased 307% from 1994 to 2005. And they're frequently ordered prematurely and/or without a clear indication in other patient populations as well. So, since I started practicing in 1990, the number of MRIs has increased 307%. Now, did we have more disc bulges in that time? Have we improved the outcomes of low back pain treatment in that time? We have not. All those MRIs have not improved the outcome of low back pain. So rather than get an MRI, what conservative things can we do? We can start moving very gently, finding ways to move that are not painful so that we can slowly and gradually expand that range of motion. We can start strengthening that spine, around that spine, so that it can support itself better. We can start working on this area, because one of the biggest problems is catastrophization. I'm going to do a whole video on catastrophization, but that basically means like, oh my God, I have a disc bulge. It's going to kill me. It's going to make me crippled. I'm going to be in a wheelchair, and I can't do this, and I can't do that, and I can't go back to work, and I can't pick up my kids, and I can't go running. I can't do so many things. Our brain just blows up the problem. And I've been as guilty about this as anyone when I had neck problems and low back pain. And I'm happy to tell you that story at another time. So basically, do not worry about getting a MRI. It's not worth it in the first 30 to 50 days. If you're still having back pain after that, it's still pretty marginal. But take the Journal of American Medical Association's word for it and know that it's not really worth it. And don't give your doctor a hard time for not prescribing an MRI. Thanks, and I look forward to seeing you soon.